Sepsis. A rapidly progressing and deadly disease. It is of paramount importance that clinicians are able to recognize the signs and treat accordingly. If you have ever had the misfortune of having to phone the non-emergency 111 number in the UK, then you would have no doubt heard a few questions during the triage. The first would have been to ask you if the patient was awake and breathing. This is to ascertain whether or not emergency CPR is required. Lack of oxygen can lead to brain death in 10 minutes and brain damage even quicker. Next, you would have been asked if there was significant blood loss, usually more than 1.5 pints in the last 2 hours, although specific measurements and timeframes can vary. This is, as you would likely imagine, to rule out whether or not a patient is bleeding to death, and to guide the caller through steps to apply pressure and minimize blood loss. You might think that if one of these issues were occurring, that an individual would phone the emergency number instead, but such calls do come through to the 111. Once these immediate life-threatening conditions are ruled out, you would then have been asked a series of questions that, at face value, might seem odd and unrelated. Nothing could be further from the truth, however, as these questions were designed to rule out sepsis. In terms of severity, sepsis falls only below individuals not breathing or literally bleeding to death. When you look at the statistics, it's not hard to see why. Sepsis acts fast and can kill in under 12 hours. According to Sepsis Trust UK, there are 49 million cases of sepsis every year globally, with 11 million of these leading to fatalities. Depending on what medical treatment is available, mortality rates for sepsis range between 10 to 40%. Make no mistake, sepsis is a killer. In older patients, even those that survive will experience cognitive impairment or physical disabilities in about 60% of cases. This means that about 1 in every 6 deaths each year is as a result of sepsis. This statistic includes non-medical deaths, such as wars, accidents and murders, as well as ones caused by COVID, malaria and cancer. To put it into perspective, in the US, sepsis is a bigger killer than bowel, breast and pancreatic cancer combined. But what exactly is sepsis? We know that malaria is caused by Plasmodium parasites, and COVID is caused by the SARS-CoV-2 virus. But what exactly causes sepsis? Well, not any one thing really. Sepsis occurs when the body has an extreme response to an infection, leading to tissue damage and organ failure. The exact mechanisms of this are still not fully understood, although research is ongoing. What we do know is that sepsis is often a response to bacterial infection, usually from gram-negative bacilli or gram-positive cocci. Sepsis being triggered by viral and fungal infections are possible, although less common, and usually only occur in already immunocompromised patients. Infections involving the lungs, the digestive tract, and urinary systems are the most common causes. In addition, infections following surgery or from an infected catheter site are major contributors. Again, while sepsis is not fully understood, we do have some idea of the pathogenicity. The body is overwhelmed by an infection and responds with a systemic cytokine release. This leads to widespread vasodilation, also referred to as hypertension. This in turn leads to fluid leakage from the capillaries. These cytokines activate the coagulation process, resulting in blood clots, reducing blood flow. Reduction in capillary flow reduces oxygen transport, as well as the removal of carbon dioxide and waste products. This in turn results in organ dysfunction and eventually failure. A sepsis infection can be broken down into 4 major steps. The first is known as systemic inflammatory response syndrome. abbreviated to SIRS or SIRS. The criteria for SIRS requires at least 2 of the following factors to be met. The patient will be either hot or cold, resulting in a temperature above 38 degrees Celsius or below 35 degrees Celsius. Heart rate will climb to above 90 beats per minute. Respiratory rate will be above 20 breaths per minute, or, if they are respiring rapidly, to have a PaCO2 of less than 32. Finally, white blood count will be above 12,000 or below 4,000. Stage 2 is sepsis, and diagnosis of such is primarily clinical. It is important to note that sepsis can only be diagnosed when at least 2 SIRS conditions are met. In addition, an infection must be confirmed or reasonably suspected for sepsis to be considered. Stage 3 is known as severe sepsis. This occurs when sepsis has been confirmed and there is also evidence of end organ damage. In addition, due to the body's circulatory system being compromised, the body starts to undergo anaerobic respiration. As a result, lactate levels will elevate to above 4 millimoles. Finally, in stage 4, the patient enters septic shock. This occurs when blood pressure falls to dangerously low levels. Prognosis is not good. Hospital mortality of patients with septic shock is more than 40%. Now that you are sufficiently scared, you might be asking, well, what should I look out for? I can't check white blood cells or lactate levels at my house. Fortunately, this slide from El Camino Health has created a rather useful mnemonic of sepsis with signs to look out for. S stands for shivering, either as a result of a fever or coldness from the patient's temperature falling outside the base range. E stands for extreme pain and general discomfort. P stands for pale skin, and S stands for sleepiness. Both of these are as a result of the compromised circulatory system. Less oxygen being supplied to the brain means that patients will become confused, drowsy, and unresponsive. Less oxygen to the extremities results in skin that is cold to the touch and pale in complexion. I stands for I feel like I'm going to die. A little bit dramatic, you might think, but it's the truth. If you talk to a clinician over the phone, they will likely ask you, do you feel so bad that you cannot do or think of anything else? Sepsis is brutal and cannot be easily ignored. You can't put on an episode of Breaking Bad or play some games. The pain you're in is far too great to be distracted from. Finally, S stands for shortness of breath. Again, as a result of the lack of oxygen being delivered. So now we know what to look for. Who's at risk? Well, technically anyone, although certain groups do pose a far higher risk. Newborn infants, the elderly, and pregnant women have all been shown to be at a much higher risk. Those with compromised immune systems are more susceptible, especially to viral or fungal infections. Those who suffer from chronic diseases, such as diabetes, kidney or liver diseases. Those who spend an extended amount of time in the hospital, as well as those subject to invasive devices such as intravenous catheters and breathing tubes. This goes hand in hand with those recovering from surgery, where infection and sepsis are primary concerns. In terms of diagnosis, the reason clinicians look for elevated lactate levels is because it serves as a sign of shock. Anaerobic metabolism occurs in the absence of oxygen, only partially breaking down glucose and producing lactic acid. Blood tests can be used to look for signs of organ damage and infection. In addition, blood, urine, sputum, and samples taken from the infected region can be sent for culture tests to detect infection. As mentioned previously, sepsis can cause patients to go downhill very fast. As a result, Whilst it is important to send off for culture and sensitivity tests, if sepsis is suspected, rapid and aggressive treatment is necessary. Broad-spectrum antibiotics should be started immediately whilst awaiting results. One of the biggest complications surrounding sepsis is antibiotic-resistant variants. As such, culture tests need to be started as a priority. Broad-spectrum antibiotics should be started, switching to specific antibiotics whose efficacy has been confirmed once available. Intravenous fluids, possibly vasosupressors, can be used to help restore blood flow. Outside of this, the means of treatment available are in trying to manage the infection. Any abscesses can be drained, and removal of necrotic tissue, where applicable, can help to control infection. Supportive care, such as supplemental oxygen or dialysis machines, can help to keep the patient stable until the infection can be dealt with. Remember that sepsis is dangerous and time is always critical. Thank you very much for watching.